interesting about working at University of Cincinnati is that we are both the general hospital for Cincinnati, so we are treating the whole population, regardless of who you come in, whether you're going to be able to pay for us at the end of the day or not. We take care of you. But we also have this other, like, upper crust treatments going on where we're doing the clinical research and we're working with pharmacological companies to do various things and test various drugs. And so it's really been interesting to see that dichotomy of patients who are coming into us. And I feel like Big Pharma has such a stake in insurance that really they are controlling one of the reasons that we can't get more done with healthcare reform. It's because there's always going to be that money. At the end of the day, it's a bottom line of the money. What money are we making? And I feel like a great example of this was when everything was going on with the EpiPen. Well, all of us in the medical field know that getting epinephrine does not cost very much money. It's a common drug. We use it, it's always on the floor. If you were to give somebody a vial of epinephrine and a couple of syringes and explain to them and teach them how to do it properly, like, okay, this will cost you $10, not hundreds of dollars, and then escalating up to almost $1,000. So I feel like it's negatively impacting, like holding us back almost from more reform because there is that bottom line of money. So
I mean, I feel like the question is a little bit loaded, and that we're supposed to say yes, it's bad.
You would say no.
And I mean, I think that those are absolutely legitimate criticisms. And I think there's no question we live in kind of corporatist America where these gigantic corporations have outsized influence through lobbying. And if you kind of take the question from a different perspective, you're like, well, that is the system we live in. We're not going to get rid of big corporations overnight, even if we wanted to. And then you think about, well, how does the ACA in particular try and address some of those issues? And I think it's something which isn't maybe appreciated much, or I don't know, the huge population of things that we're talking about, but when there was this 85-15 rule, or 80-20 rule, and what it was talking about in the ACA was that if you're a healthcare provider, if you're Aetna, you're not allowed to spend 50% of the policy premium that you get on advertising or on administration or on the Learjet for your CEO. You have to spend 80 or 85% of the money that you receive on the healthcare that you deliver to that patient. And sort of they push back about these numbers, and it's kind of an ongoing issue. But there's still this idea that in the legislation there's a mandate to spend money on patients. And I think that it's kind of one example where the ACA acknowledged the problem with having kind of big companies that are ultimately, as you said, sort of interested in their bottom line. I mean, that's how the system works. In trying to address that, but trying to realize that being the system we work with, how can we try and curtail that and still have them administer the healthcare that we want? But yes, the big corporations run our government.
So I'm not a fan of either big pharma or the insurance companies for sure. But I don't know if the Affordable Care Act was considered good or bad by them. So if you think about it from the pharmaceutical perspective, if you're selling medications, you need people to pay for them, right? And so more people with coverage, 24 million more people with coverage, they have more funds to pay for that. On the other hand, there was a tax on the pharma companies of like $20 million. So my guess is they probably came out ahead on that, but it's not clear that it was a big windfall for them. On the one hand, they got more coverage, the other hand, they had a tax. For the insurance plans, they actually had a tax of about $60 million on theirs. And again, because they had new markets that were opened up both through Medicaid and through the exchanges. I think the insurance plans really got blamed unfairly when they started pulling out of the exchanges. And they pulled out of the exchanges because they had only sick people buying insurance, and in order for them to sell insurance, they had to increase their rates above the 15%, above what people could afford, and they knew they couldn't sell it. And the reason they had such high rates is young people either didn't pay the penalty or did pay it. Either way, they didn't join up. And so you had a risk pool of a bunch of sick people. And that's not how the insurance concept works. The insurance concept works is that you have mixed risk in your pool, and some people use it, and some people don't. And that way you can spread the expense around. So, you know, even the most benevolent of insurance plans, I think, would be forced to pull out of the exchanges. But they're an easy target because, particularly if you're a politician, anytime you want to blame the insurance plan, nobody's going to come up and say, "Wow, I think they're pretty good for this," you know. But I'm not sure that either one gained or lost. You know, it wasn't a big windfall or a big debacle for the one. Insurance companies, I think, probably got hurt because they lost money in the year or so before they actually pulled out. That was probably the problem.
That actually makes me feel a lot better. Thank you.
You're right.
I mean, I think that one of the sort of, in terms of critiquing Democrats instead of Republicans for a minute, the construction of this bill as just a sop to the insurance companies, I think, is an unfair thing. I mean, we really, particularly when you think about something like mammograms, and you think about the fact that this was, in large part, a tax on rich people to pay for healthcare for people. This was a huge step forward in terms of healthcare in America. It wasn't perfect, it wasn't where we'd like to be, but it was a big step forward. And to present this as just, oh, this is just as bad as it was, it's just free money for the healthcare companies, I don't think was a fair construction that I think was levied by sort of the far left against the mid left now.
Thank you.